Hey guys, it's Gianna, Midwifay. Today I wanted to talk all about vaginal exams, okay? What are we doing when we go in there to check how dilated you are? What are we feeling? What are we looking for? What does this mean? I've got my props with me to help all of you visual learners. So let's get into it. So let's first start with what is a vaginal exam, okay? A vaginal exam is a type of pelvic exam where an OB provider or nurse goes in through your vagina. We insert one, then two fingers with a sterile glove to feel your cervix. So this is a specific type of pelvic exam, not one that's done for your pap or something like that, where we're specifically looking to touch and feel your cervix, to feel how open it is, to feel how soft it is, how thin it is, etc. So here is what I call a dilation wheel, okay? So this is a visual representation of what your cervix looks like at different levels of dilation. So this is 1 centimeter, 2, 3, 4, all the way to 10. Okay, mama, this is how amazing your body is. Okay, so bear with me using my props here. So here we've got our placenta, our baby in the sac, and coming out through the pelvis, okay? So if I am going in to check your cervix, right? This is your back. You're going to be laying down. I'm going to go in with my fingers, like I said, 1 and then 2 first with the sterile glove. And then we go in and I'm going to check to see how open and dilated your cervix is. Now, this one is pretty open. I'm going to have to adjust the sky a little bit. Okay, so let's use this as a visual. What are we feeling for when we're in there? When we go in with 1 finger, then 2, what are we feeling for at your cervix, okay? At the opening to the uterus, okay? Here, this is visually what we're looking for. Baby's head, this is a closed cervix, okay? Now, this is a very thin bag, so this is a very thin cervix to start out with, so I can't demonstrate effacement or thickness of the cervix with this, but it's a good visual for looking at it dilate. Okay, so right now it's basically closed, maybe fingertip, I can kind of get a finger in there. As baby's head pushes down, more pressure, it opens a little bit more. Now we're like 2, maybe even 3, pushing more, contractions more, baby's head is applying more pressure. This is, oh good, this is like 6 centimeters dilated, etc., etc., until baby emerges out of the uterus, okay? So this is a good visual for what are we feeling for when we're checking with our fingers for a vaginal exam. Now that you've seen a visual of what we're feeling for when we're checking your cervix, let's talk about what they mean. Is it accurate? I've discussed in a previous video something called the Bishop score, okay? So when we're checking your cervix, we're checking for a few things: how dilated, how open it is, how soft it is, how thin it is, and how low it is. So what station the baby's in, okay? It's not just the number, how dilated you are. A vaginal exam can tell us, obviously, how far along in labor you are. It also can tell us if you're at risk for labor, if you're early, if you're preterm and starting to have contractions or bleeding or something like that, or you're at higher risk for preterm birth. Sometimes your provider might do a vaginal exam earlier, before 37 weeks, to see if it feels like your cervix is getting thin, getting soft, or dilating at all. Is it possible for me to know if you're in labor without having your cervix checked? I mean, yeah, all of us experienced birth workers, nurses, midwives, doctors, when we hear someone in labor, most of the time we're right and we know when someone is in labor or not without checking their cervix, okay? However, especially when giving birth in the hospital setting, once you arrive to the hospital, to L&D, to the triage unit, you're gonna get at least 1 cervical check, okay? And that's to establish, yes, that your cervix is starting to dilate, how thin it is, to confirm you're in labor. I wanted to mention that because people talk about in out-of-hospital birth settings how they didn't have 1 vaginal exam, maybe at the end right before pushing. And that's great, and that is possible because, again, I can tell if someone's in labor or not most of the time listening to them over the phone, looking at them in person, without having to check their cervix. However, in a hospital setting, more than likely, you're going to get a cervical check to assess if you're in labor and to assess labor progress. Now, how accurate are they? You know, the recent diagnosis of active labor for a first-time mom is 4 centimeters, okay? So looking at our dilation wheel, here's 4, okay? 4 right there. And for someone who's given birth before, active labor is defined as 6 centimeters, okay? So here's 6. Now, have I admitted people who I've known were in active labor before this 4 or 6 centimeter threshold? Yeah, and that's because there's a lot of other sure signs of labor that you can pick up on that aren't always just the cervix. If you want to know about that, please watch my sure signs of labor video. I talk all about that. So I say that to say, if you're having strong and regular contractions every 2 to 3 minutes that are taking your breath away, if your water is broken and you're doing those things, maybe you're 3 centimeters or even 2 centimeters, but your cervix is 100% thinned out and the baby is at 0 station, you know, by definition, you're not in active labor. But I don't want you to get so discouraged and hung up on the number, okay, of dilation. Again, when we do a vaginal exam, we're feeling for softness, thinness, and openness of your cervix, okay, as well as baby's position in the pelvis. So don't be discouraged if you get there and you're feeling really uncomfortable and working hard and someone tells you you're 2 centimeters, 100% thinned out and 0 station. That is a great vaginal exam, okay? And that could very well mean you're in active labor even before this 4 centimeter point for a first-time mom. So it's not just about the vaginal exam. I just want that to be something that you go away with knowing, so that you're not discouraged if you follow my sure signs of labor video, you get to the hospital and you don't hear the number 4 or 6, but you're still regularly contracting. It's taking all of your energy to focus on those contractions. That's still labor. I want to talk a little bit about situations when a vaginal exam might not be necessary. Again, I mentioned in the hospital setting, we do more vaginal exams probably than are totally necessary. Definitely when you get to the hospital, we'll do one, make sure baby is head down, make sure you're in labor, etc. And if your water is broken, we really want to limit vaginal exams. Once that bag of waters is gone, that increases the risk of infection every time we go in and check with our fingers. So that's one important thing to keep in mind, is once your water is broken, unless something is really different clinically, you're in a lot more pain or discomfort, something's concerning with the baby's heart rate, we're not just going to check your cervix all the time to know how dilated it is, because that can increase the risk of infection. And another time that I want to encourage you to question, if not refuse, vaginal exams is while you're still pregnant. A lot of OB providers, mostly physicians, towards the end of pregnancy, 36, 37 weeks or so, start doing a weekly vaginal exam on you. Now, if you're a low risk, normal, healthy person, no signs of labor, there's not really a point of doing that exam, okay? Every week they would check you, you're gonna leave saying, oh, I'm closed, oh, I'm 1, oh, I'm not dilated, but I'm thin. And it's just this mental game that doesn't need to happen. So I encourage you to at least ask if these are necessary, if your provider wants to start doing weekly vaginal exams at that 36-week mark, because honestly, it's not indicative of if labor is coming or not. And I would rather you not have to go through it in your brain, constantly thinking, at my appointment I was this many centimeters, or I wasn't dilated, this sucks. Or vice versa, oh, I'm 3 centimeters, this is great, I'm gonna be in labor tomorrow. Not necessarily the case. So that was all about vaginal exams. I hope that helped. I hope the visuals helped. Let me know if you have any other questions in the comments or if you need anything clarified. All right, thanks for watching. I'll see you later. Bye-bye.